Hey, welcome back to the Private Parts of Wellness, the podcast where we talk about the things your best friend and you might kiki about, but you won't necessarily hear from your provider. We're going to talk about sex, hormones, guts, grief, glow-ups. It's all part of what we do here. Today's episode was a request by one of you. So when I say I want requests, I want to know what is on your mind, what you're curious about. I mean it because I will address it. This person said, how about women, major surgeries, trauma, and healing? Well, they didn't get more specific on what they want to know exactly, but I'm going to go with it as is. Because this question was something I was thinking about in 2013. As you may or may not know, I've been talking about sex and aging for quite some time. I started to get interested in this stuff in 2011. And in 2013, I came out with a survey about sex and hospitalization, not having sex in hospitalization, but how do you feel after? I wanted to know what was intimacy like after surgery? What happened to your desire, to sensation, to touch? What happens when we feel happy we survived, but disconnected? All right. This podcast is for educational purposes. This is my big disclaimer. I do swear. I try not to. It doesn't go very fucking well. But again, education, information only, not medical advice. Please consult your team, a licensed provider about your decisions. And before you make any decisions, especially when you're recovering from surgery or managing hormones or mood. Let's talk about these stories that we carry. The survey. So I created this survey in 2013. I just did it because I get curious and I love research. I really do. I really like asking questions. I'm a nosy. Curious is better. And I wanted to explore sex and surgery and recovery. Some patients responded, some partners responded, and overwhelmingly what it revealed was a gap in emotional and sexual support after surgery, post-op. Some of the quotes that got pulled from there were, they gave me all the information on physical health, but nothing about how to feel human again. Another one said, no one said a thing about intimacy. It was like I wasn't expected to be a sexual person anymore. And then another quote was, I didn't feel like myself anymore. I wasn't in my body, and I definitely didn't want anyone else in it. That sounds like something I would say. So to say that many of the stories started with recovery is true. And when we think about surgery, we think a lot about what it means afterwards. But I want to start in this conversation about, well, someplace a little bit stranger, a little deeper, maybe. When it comes to surgery, trauma, and healing, it's often the gut. Oh, that was my stomach just growled. It's often that it's the gut is where things start to fall apart. The gut is, in a sense, where trauma rests and plays out. So all surgeries, not just gynecological, or in all illnesses, especially when we think about hospital stays or big illnesses, something where you might need to use antibiotics for a long time, they disrupt the gut. Pain meds, anesthesia, antibiotics, immobility, all affect motility, movement of the gut. So it goes into the mouth and out the butthole, and the microbiome diversity. So microbiome is a word that you might be hearing a lot of. And now that you've heard it, you're going to see it a lot on your Who's-a-Mababi, right? Coming up on the Instagram and the YouTube and all of that. So microbiomes, the bacteria that we have in our gut, which is good and bad. So when the diversity is off, not balanced, a little bit more one way as opposed to another way, meaning bad bacteria, good bacteria, no such thing. But, all bacteria thinks it's doing a great job. The gut symptoms post-op can be bloating, constipation, nausea, even shame and disconnection. This is because the gut is our second brain and it responds to trauma. You can even think about an episode in your life, something that happened. I'm thinking like the stories that we hold on to. You can think about a time in your life and it could be a little T trauma, big T trauma, and think about like, what was your gut reaction? Did you feel it in your gut? Did you have butterflies? Did you have a sinking pit in the stomach feeling? The gut is our second brain. And again, it responds to trauma. Trauma can be a hospital stay. Trauma can be a surgery, even when it's life sustaining, even when it's life changing, even when it's like the best thing ever. And even when it's voluntary, but we're talking about, in most cases, the non-voluntary things. It can trigger IBS like symptoms, irritable bowel syndrome symptoms. And that can be constipation, that can be diarrhea, that can be a mixture. Trauma survivors, especially with high ACE scores, tend to have more persistent GI issues. Now, if you've listened to two of the episodes I did before on the ACE score, adverse childhood experiences, it's a 10-question tool. And when we think about trauma, you only need to say you've had 2 of those things to set you up for possible more trauma later in life and health problems. And a score of 4 or above is a toxic level. I invite you to revisit those 2 episodes. It's interesting. We know when it comes to women's health, because the question really was women centered, a score of 4 or higher will sometimes correlate to postpartum depression and also worsening menopause symptoms, as well as more sexual dysfunction. The same can apply for men or however you identify, but a higher score, especially when it comes to sexual dysfunction. More specifically, when we're thinking about hormones and gut and the microbiome, there's something called estrobolome. I always have to like break that down because I have a habit of skipping over vowels. And the gut regulates estrogen detox and recycling. Postmenopausal or low estrogen states will slow gut motility, meaning that movement, and increase inflammation. So when we think about estrogen and in the sense of menopause care, it's not that we stop making estrogen. I think I talk about that in a different episode, like the different types of estrogen. I talk about that a lot. We don't stop making estrogen. We stop making a particular type of estrogen, which is estradiol. That is what is replaced in HRT. We do, however, make estrone, and that's from the adipose tissue, the fat. That's why we get a little more belly fat and our cholesterol goes up. But that has to be moved out of the body. And the way that is moved out of the body is through our doo-doo, straight up doo-doo. So if you are postmenopausal, meaning you're not getting a period anymore, and that could be due to surgical reasons, that could be due to chemical reasons, that could be due to just kind of that's your time in life, or you have very low estrogen. So these periods where it dips because you're going through perimenopause, you might notice that you're not doo-dooing as you should. And you also might notice that you've got a little more sense of panic, a little more palpitations, a little more unease. Estrogen, progesterone, and testosterone all influence digestion, repair, and your immune function. So when the gut gets hit, whether it's trauma, stress, or surgery, it tells the whole nervous system something is not right. So where is that happening? When we think about the nervous system, we're thinking about the parasympathetic and the sympathetic. Sympathetic is our fight or flight, and that's where a lot of us just live. We're hustling, we're moving, we're going, got to do this, got to do that, sleep fast. And then there's the parasympathetic, and the parasympathetic is our rest, digest. The parasympathetic is actually run by a particular nerve. It's called the vagus nerve. And the vagus nerve runs from the brain stem to the gut, to the heart, and to the genitals, straight down, as well as the lungs. It controls, again, your rest, your digest, your connect, your parasympathetic. And after trauma, it collapses into a different state. Now, this is going to sound a little bit, maybe you've never heard of this. The idea was that you have the sympathetic, parasympathetic, enteric nervous system. But then there was this theory that came up that said, actually, there's a different part of the vagus system. You have the rest and digest and connect. And there's actually a second part that passes way down passes through the sympathetic, and almost as if you've hit so much trauma that you get into a part of the vagus nervous system that is called the dorsal vagal shutdown. The dorsal vagals. You have the ventral vagal, sympathetic, and dorsal vagal. And what that dorsal vagal is in this polyvagal theory is that you have freeze, numb, dissociate. Now, again, I am not a cardiologist. I am not a neurologist. I am not a psychologist or psychiatrist. I'm not a gastroenterologist. I am a family nurse practitioner. Oh, I didn't introduce myself. My name is Jessica, family nurse practitioner and menopause provider. And I'm super, super curious about a lot of things. With that, you may have more information and you can bring that to me and say, hey, I want to clarify some stuff. But there is a system, back to this polyvagal theory. There is a system created by Stephen Porges, and then Deb Dana is one of the master teachers around this theory that says we actually pass through, our nervous system passes through different stages. And again, we have a ventral vagal, which is regulated, social, connected. In this theory of polyvagalness, the polyvagal theory, there are three parts. There's the ventral vagal, where a person is feeling regulated, social, connected. Then there is the sympathetic, where we might be in this constant state of fight or flight. And finally, there's the dorsal vagal, which is collapse and shut down. Interestingly, I think if you play with these, if you are interested in learning more about polyvagal theory and playing with them, you might find that you are easily able to access that sense of fight or flight. And for some of us, it's easy to touch the collapse and shut down. But what's harder is that sense of ease and regulation and connectedness. We're going to actually do a little bit of work around this, but wait till the end. So there's a somatic connection to these feelings as well that I think is really interesting. And that is emotional pain is real pain. New York Times in 2016 came out with an article that showed that Tylenol, acetaminophen, may reduce emotional distress because trauma is embodied. And what do I mean by embodied? Like, trauma doesn't ever really happen on the outside of us. It can, but unless we process it and move through it and have witness in a certain way, it lives inside of you, and it can show up in a lot of, the most obvious way I think for a lot of people is, especially for women, is gut issues. Like, I have had gut issues my whole life, and I can pretty much tell you when they started and all that wild shit. And that's what I mean by embodied. Trauma is embodied. And when we think about pain in general, your system cannot necessarily tell the difference between emotional and physical pain. For example, when I talked about this New York Times article, it was essentially saying that acetaminophen, when taken for heartbreak, and I'm not talking about heartbreak as in heart disease, but I'm talking about a breakup, a social distress, it can help to alleviate some of the grief. And that is because there's a similar pathway that physical pain and emotional pain take in the brain. And that actually brings us to heart. It also brings us to the libido, because you cannot heal the libido or your gut if your body thinks that it is in danger, period. Back to that survey, people saying, I didn't feel I was in my body after surgery. A lot of them said that their surgery was successful. However, that disconnection ended up causing them to feel unsafe. Anyway, let's talk specifically about the heart, because the heart is not only an emotional center, but it's an organ that I feel mainstream ignores when we think about women's health. A lot of times when we think about women's health, we focus on breast cancer, uterine cancer, cervical cancer, endometrial cancer, ovarian cancer. We focus in on these body parts that are very specific to certain body types. However, the number one killer of women is heart disease, period. That's number one. And in addition, we don't talk about heart trauma, and we need to start to talk about that, especially when we think about this emotional labor that people go through and calculating the emotional labor. Let's talk about something adjacent to that emotional heartache that you have with a breakup. Because there's actually something called broken heart syndrome, which is Takotsubo, and I may be saying that right, but it's Takotsubo, which is broken heart syndrome, and it mimics a heart attack, mostly affects postmenopausal women, and is triggered by trauma. And it is a real thing. It is reversible, but it's not an overreaction. It's not Sanford standing there gripping his heart, talking like, "This is my time, Elizabeth," right? Whatever he was saying, "Here I come, Elizabeth." It's not that. It's not this over dramatic thing. It is an actual physiological response to heartbreak. Now, Tylenol can't fix it, but I'm stepping up from that heartbreak of breakup grief to something a little more traumatic, Takotsubo, and that leads us to heart disease. Because those people who have experienced more severe cardiac interventions, say post heart surgery or heart attack or angioplasty, they may actually experience something called cardiac depression. And cardiac depression is an actual real ass thing. It is this feeling of sadness, no libido, lack of motivation that happens after cardiac manipulation, like literally somebody fucking with your heart. And it, again, is often dismissed. In fact, I first heard about it when I think Arnold Schwarzenegger had his cardiac surgery. And I think it was that concept of having this big, strong Terminator talking about emotional problems after heart surgery. And I want to tell you a little story about that. Not Arnold Schwarzenegger, because he and I did not talk. But I will tell you about why this may hit postmenopausal women more. In 2003, I was talking to somebody in my life who actually had been part of the Women's Health Initiative. At this point, I believe, I don't know what, we're talking 20 years ago, right? She was in her 60s and she was a participant. And she shared that the study was over and she now knew that she should never do HRT, should never take hormone therapy. Listed all the reasons: heart attack, cancer, blood clots, all of those things. Now, simultaneously, my mother, who had been on hormone replacement therapy, was abruptly taken off of it. Now, in the meantime, between time, that same year, 2003, I also became a parent. And I was knee deep in noticing how my hormones changed, what was going on with my body, what it meant to parent, breastfeed, all of those things. Fast forward, I'm sitting in the pandemic after studying and leading workshops on menopause and perimenopause, really suffering from my own perimenopause. Sometimes it's hard to be the clinician, be the patient, be the daughter or daughter-in-law, however, family member. I'm drinking some water, biodegradable cup. And I remembered that I have an extensive family history of heart disease. I also realized I was feeling horrible. My blood pressure was creeping up. I was doing all the things. I was stressed out by the pandemic. And I decided to start HRT in order to protect my heart and take care of the night sweats because they were gross. Now, around that same time, no, probably earlier, years before the pandemic, I guess, the same person who was a participant in the WHI study on HRT, around 70, I would say 2013, 15, around there, So before I started HRT, had a heart attack. This was a woman who was extremely fit, extremely physically strong, ate extremely well, didn't smoke, didn't do drugs, drank a glass of wine, and had a heart attack. For me, putting all of these stories together further informed me that protecting my heart was the most essential thing I could do for myself and for my family. I was a person who struggled with gut issues, and I still have them, by the way. I got to tell you, struggle with gut issues, was on the verge of having to be on cardiac medication. And I was also going through a very hard hormonal transition, which I'm still fucking going through, honestly. It's not hard anymore. It's just, I still get a stupid period. And the best thing for me, for my choice to get those three things to start to work a little bit better was to address my hormones. That was my choice. And by addressing my hormones, I was able to take the pressure off and get more connected with my body instead of fighting my body or thinking it's always been a disaster. How do we support this triangle, this heart, the gut, the hormones? When we think about trauma, surgery, and healing, what can we do? So you know now that trauma definitely plays a part in our healing, not so much in the sense of like we need protein for wound healing or we need certain minerals and vitamins and organ systems to work to heal. Yes, that is a given. And that's where the gut comes in. We need the right microbiota to help us to heal, to move whatever medications, whatever processes we take in physically to move through our body. But we know that trauma, in order to fully heal, not only physically, but emotionally, and move forward and adapt these new bodies, these new senses of self, we need to look at the shit we didn't want to look at in order to shit out. And we need to get our hormones right, which doesn't necessarily mean you need to take hormones. Let me be really clear. And I'll talk about that in a second. So let's do a polyvagal practice. So let's just say that you do identify with this concept of a space where Dana talks about a ladder. At the top of that ladder is where you are rested, you are connected, you are in the flow of things. And in the middle of that ladder is that sympathetic, that getting to work, that doing what you need to do, that making your appointments, being there for everybody, all that shit, that hustle, that day to day, that grind. And sometimes you pass and follow right down through it and you go into that melting, that dorsal place where you can no longer function. Let's say that you are someplace you can identify that, close your eyes and see that ladder and know that sometimes you fluctuate between centered and too much fire, and then you drop right down, or sometimes you're at that too much fire and then you collapse, especially if you, like me, are a neurodivergent friend. I want to talk you through a Deb Dana inspired practice. It is simple. You can do it at any time. And let's just notice if it can bring you into more of the ventral vagal, that calm space for healing where you're not fighting as opposed to the others. All right. So in order to do this exercise, I want you to just notice where you are and just relax into it as best you can. Even if you're on the subway, right? Just lean into it. It won't take long. And the first step is to anchor. So in your mind, name a place, a color, a smell, a taste that you associate with safety. That can be apple pie. That can be a beach. That can be an imaginary planet. Whatever that is for you. It doesn't have to be real, but notice and name it. Be orange or blue. Good. Now, the second part is to hum. So I'm going to walk you through humming. I want you to inhale for a count of 4 and then hum for a count of 8. Do that about 3 times. And now notice, come back to your anchor, your place, color, smell, whatever it is. Notice what softened. This is what vagal tone feels like. It doesn't have to be perfect. It may just be a taste of vagal tone. And in this theory, this is the place that we heal from. I want to give you 4 action steps while you're sitting here and receptive. If you are post-surgery, pre-surgery, or have a loved one who's going through a medical intervention, you want to ask, what did or will shift after surgery? What do you fear won't come back online? Or what do you notice didn't come back the way you had hoped or were surprised by? The second step is to check in and support your gut. Maybe it's that you're taking magnesium. There are 9 types. Let's say citrate to help you poop. Are you taking a probiotic? Fermented foods are helpful. Bitters and movement. How are you supporting your gut? Because the gut is where we make our good feelings like serotonin. Number 3, how are you supporting your hormones? Yeah, it could be estrogen, progesterone, DHEA, testosterone, all the outside hormones. Or again, it could be your gut. It could be that you're taking DIM, which is like 1,000 pounds of broccoli into a pill. It could be that you are lifting weights. It could be that you're sleeping better, focusing on your sleep. That supports your hormones, as does movement. Number 4, how are you reconnecting with your body? Scar massage, gentle touch, touch without the need for it leading to sex, support through pelvic floor physical therapy, or even noticing the sensation from erotic audio. So those are 4 things that you can do to see where you might need support and find easy, small steps to take it or to find it. Have you had a surgery or health experience that changed how you felt in your body or feel in your body, your gut, your heart, or your sex life? And if you have, I would love to hear about it. I'm going to leave the link to the questionnaire that was started in 2013. You can also leave me a speakpipe.com private parts of wellness, one word, private parts of wellness voice message, or you can DM me in the Instagram. I'd love to hear. This episode was not about creating a protocol. It was about naming what you probably already know. The heart, the gut, the hormones, healing are all about a triangle. We can return to them slowly, centrally, safely. I hope that this takes some pressure off. And I also hope that for the special listener who requested this, I want you to know that I saw, I knew it, and I appreciated it. This is hard work that you do when you are being present for yourself and others. And when we're asked to essentially leave our bodies, sometimes it takes a minute to get back in it before we can support other people. So anyway, if you know, you know. All right, that's it for today. I hope that answered the question. I hope to hear from you and let me know how this went. I love your question. Thanks.